From our 22 News Broadcast Center, this is 22 News in Focus.
Good afternoon and welcome to 22 News in Focus. I'm Nick Oresco. February is American Heart Month. According to the CDC, heart disease is the leading cause of death for men, women, and people of most racial and ethnic groups right here in the U.S. Nearly 700,000 people died from heart disease back in 2021. Knowing the facts about heart disease as well as the signs, symptoms, and risk factors can help you take steps to protect your health and seek proper treatment. Today on 22 News in Focus, we'll be discussing the different types of heart disease, treatments, and prevention efforts. Our first guest is Dr. Quinn Pack, Medical Director of Cardiac Rehabilitation and Wellness at Bay State Health. Thank you for being on the program today.
My pleasure. Thank you.
All right, so let's get down to the basics here. Start with, if you can explain what heart disease actually is.
Yeah, so heart disease, obviously, there's many diseases of the heart. And one of the ways I like to explain to my students is that there's really 5 key components of the heart. The first is the actual muscle. That's what pumps the blood. But then you need the arteries that supply the blood to the heart so that it can pump. You need the electrical system to keep the heart in rhythm, working together. Then you actually have the valves themselves that keep the blood moving in a one way or in a forward motion. And then you have the pericardium, which is really the heart's casing. And each one of those systems has diseases that affect it. When we talk about heart disease, which is the general term, what we're generally talking about is coronary atherosclerosis. It's that waxy plaque buildup in the arteries that prevents the arteries from delivering the blood to the heart. So when someone has a heart attack or a stroke, it's almost always that waxy atherosclerosis in the arteries that's causing problems.
Are there different types of heart disease?
Certainly. So, I mean, again, there are a lot of risk factors. There are other kinds of, you can have heart failure. That's a problem with the muscle. You can have an irregular heart rhythm like atrial fibrillation. You can have a condition where the valve doesn't work like aortic stenosis. But again, when we're talking about the heart disease that most people think of, it's really that buildup of the waxy plaque in the arteries that cause blockages.
Anybody, of course, can get heart disease, one of the leading causes of death, as we mentioned off the top. Is there a specific or primary cause of developing it? Absolutely.
So there's really 4 or 5 key risk factors. And the first is smoking, huge problem. High cholesterol, very manageable with medicines, with working with your physicians. High blood pressure is a big risk factor, and then diabetes. In America, in the last 20 years, we've seen rising rates of diabetes, we've seen rising rates of obesity, and unfortunately, we've actually seen an inflection. So for 50 years, heart disease was on the decline, and in the last 10 years, we've seen an inflection. Heart disease is on the incline.
So as you as a doctor, you see this all the time, I'm sure. How do you diagnose it?
Yeah, so there's a lot of tests for heart disease. The most common test that people think of is an EKG, where you put stickers on the heart, on the chest, and you look at the electrical activity. But you can also do an ultrasound, a CT, a cardiac MRI. Obviously, starting with a risk assessment with your physician is the most important place to start if there's concerns. And then there's blood tests and more.
You mentioned cardiac arrest and heart attack. Is there a difference between the two?
Yeah, so this is actually, there's a common mistake to assume that a heart attack is the same thing as a cardiac arrest. Cardiac arrest is when the heart stops beating and the blood pressure falls and the patient faints. And many times the heart doesn't ever restart, and that would lead to sudden cardiac death. A heart attack is when that waxy plaque buildup blocks the artery and prevents the blood from getting to the heart, and then part of the heart dies. Now, a heart attack can lead to cardiac arrest, but there are other things that can cause cardiac arrest and other things that can cause a heart attack. So they're very similar, but slightly different.
Obviously, both a major issue. Some people don't even know they are even having a heart attack. What are some of the signs and symptoms to maybe understand what is going on?
Yeah, so I mean, if you feel something unusual in your chest, chest pressure, chest pain, chest tightness, chest discomfort, or an irregular heart rhythm, those are things you ought to report to your doctor pretty quickly. If you faint, now most faints are not cardiac, but if you faint and you have a history of heart disease or you keep fainting, one of the ones that I would say is the most important is if you are exercising or walking or stressing yourself, such as upstairs or going on a walk, and you get any sort of discomfort in your chest that comes on with exercise and goes away with rest, that's something that needs to be reported to a physician.
After a heart event, a patient may be seen by a cardiac rehabilitation or sent to that. What does cardiac rehabilitation consist of?
Yeah, so in my role as the medical director, what we do is we take patients who have had heart disease, whether that's valve, heart failure, or a stent. You'll get to talk some more about that. And we help them start to exercise. And it's in a really safe environment where there's nurses, exercise physiologists, hearts are monitored, and it's a great place to strengthen the heart. People live longer, they feel better if they come.
Sometimes after a heart attack, people don't want to exercise, work out. They're afraid to get their heart pumping again. What do you suggest to those people who may be afraid?
Yeah, so the first thing is come to cardiac rehab. It's a safe place to start an exercise program. Most exercise is extremely safe. This is the other thing. The incident of a real problem in cardiac rehabilitation is about 1 in a million. So like, it's really uncommon. But it's actually interesting you ask, because we have a grant at Bay State that's funded by the National Institute of Health where we're trying to study this exact thing. It turns out that helping people through that anxiety, helping them get started, can really, really improve their long-term outcomes.
How do you know when someone is ready to leave the rehab program, and is there any follow-up afterward?
Yeah, so we continue to follow people for 3 months, and then sometimes we see them back again. We have a standard program. We want people to be more fit. We want them to be exercising and feeling well. Typically, we go for 3 months, and we encourage them to go the full distance, and that really works well.
Let's look at some prevention measures now. What are some ways that people can reduce their risk of developing heart disease?
Perfect. So we talked about high blood pressure. We talked about cholesterol, diabetes, and smoking. Those are the 4 big risk factors. The American Heart Association also has what they call Life's Essential 8. So if you remember nothing, go look this up. Life's Essential 8: smoking, tobacco, smoking, hypertension, diabetes, and blood cholesterol. But the other 4 are sleep, weight control, exercise, and healthy nutrition. And there are estimates that suggest that if people actually followed the guidelines, that 80, maybe 90% of heart disease is preventable.
Are there annual testing or screenings that people should consider?
Yeah, so if you're over 50, actually, when you turn 20, you should go get your cholesterol test, because there are some genetic predisposition for very high cholesterol. So if you're over 20 and you don't know what your cholesterol is, go get it checked. Same thing if you have a predisposition for diabetes in the family, get your blood sugar checked. In general, if you're over age 50 and you're following up with your primary care, you're getting your blood pressure measured, you're managing your weight, you're checking your cholesterol, your blood pressure, and for diabetes, that will take you a long, long way. And quit smoking.
Right. You mentioned the age of 20. Obviously, a lot of young people don't even go to the doctor to begin with because they think they're fine. What do you tell maybe people who are 20, 25 that maybe you should consider at least getting checked out to help prevent you from getting into a serious problem? Yeah,
so healthy lifestyle starts as soon as you're born, basically. But in our early 20s, there are a lot of college students and young people who think that there's no tomorrow, they can just live life, and so they take up habits. Vaping, one, which we don't know a lot about. Alcohol, another, which we actually know to be quite harmful. There are things that people can do in their 20s and 30s that will make them thrive throughout their whole life.
With vaping, obviously, marijuana, THC, CBD, obviously not a lot of research has gone into, maybe a lot of research, but not a lot of results have gone into that. Are there maybe some side effects with marijuana use related to heart disease, or we don't know?
Yeah, so this is great. Thank you for asking. Marijuana is not safe. For anybody who thinks that it's safe for your heart, it's not. The data is coming in, and I expect over the next 20 years there will be an avalanche of data, but the early signals show harm, increased risk of stroke, increased risk of heart disease. Now, it may not be the THC, but the smoke and the particles and the carbon monoxide that you get from smoking it, it's just as harmful as a cigarette.
Bottom line, don't smoke.
Don't smoke anything. I want you to breathe only good, clean air.
All right. There have been significant strides in treatment for heart health issues. We'll find out what they are when we come back. You're watching 22 News in Focus. Welcome back to 22 News in Focus. Today we're talking about heart health as part of American Heart Month. Joining me now is Dr. Andrew Goldsweig, Medical Director of Bay State's Cardiac Catheterization Laboratory. Bay State's Regional Heart Attack Program is known nationally for delivering life-saving care. Let's turn to the latest technologies in treating cardiac patients, and that's when we bring you in, Doctor. What is interventional cardiology?
Sure. Interventional cardiology is a subspecialty of cardiology. It involves minimally invasive procedures. Essentially, we treat various heart diseases using tiny tubes or catheters that are fed through the arteries and veins, usually in the arms and legs, to reach the heart and deliver often life-saving treatments.
So what is the cardiac catheterology, or catheterization rather, laboratory? What does that mean and what does that do?
Yeah, so I'm the director of Bay State's Cardiac Catheterization Laboratory. The catheterization laboratory is really the facility where all the magic happens. At Bay State we have a relatively new, 9-10-month-old, $32 million facility that has 4 laboratories. We've got X-ray cameras that allow us to take pictures of what's going on inside the body and inside the heart, and a whole variety of monitors and treatment devices to allow us to fix disorders of the heart.
I'm going to throw a lot of letters at you. I'm sure you know what they mean. Can you explain to me the LAAO procedure? What is it used for?
Sure. Alphabet soups in cardiology. LAAO stands for left atrial appendage occlusion. Let me take a step back. Atrial fibrillation is the name of a very common cardiac arrhythmia. It's often called AFib. It affects about 25% of people in the United States at some point in their lifetimes. People with AFib are at increased risk of having a stroke because a blood clot can form in a tiny pocket of the heart. That pocket, that's the left atrial appendage. That's the LAA. LAAO, left atrial appendage occlusion, is that we can close off that pocket. We can prevent stroke from occurring to people who have atrial fibrillation without using medications like blood thinners that may not be well tolerated.
I have some more letters for you. Another one is the TAVR procedure, and why is that used?
Yeah, TAVR stands for transcatheter aortic valve replacement. The aortic valve is one of the 4 valves of the heart. It's the last valve in the series, and it regulates flow from the heart to the body. In about 3% of people, wear and tear over a lifetime of use causes that valve to become thickened, fibrous, hard, and not open normally. For those people, they can experience shortness of breath, chest pain, fatigue. Often, that needs to be treated with valve replacement. Historically, valve replacement required open heart surgery. TAVR, transcatheter aortic valve replacement, means that we can actually replace one of the heart's valves through a catheter, a tube, about the size of the hole in the end of a ballpoint pen.
Can mitral valve repair be done without open heart surgery, and what is that procedure?
Yeah. The mitral valve, the third of the heart's valves, regulates flow between the 2 left-sided heart chambers. Mitral valve repair can be performed in a catheter-based or minimally invasive fashion as well. Currently, there's a procedure called transcatheter edge-to-edge repair, where the 2 leaflets of the mitral valve are actually clipped together to support each other to prevent leakage between them.
So how do you determine who is eligible for those procedures?
People come to our clinic to seek consultation from a variety of places. Some people have experienced symptoms and directly seek us out. Some people are referred by their primary care physicians or by their general cardiologists. We evaluate people in terms of the symptoms they're having. We use imaging, things like echocardiograms or ultrasounds of the heart, CAT scans of the heart, and ultimately try to determine what the anatomic disturbance is that may be causing their symptoms. If we find something that we can fix, we're happy to do it in a minimally invasive fashion.
What are the benefits of these types of treatments as opposed to maybe traditional surgery?
Yeah, so interventional cardiology offers the opportunity to do things in a minimally invasive fashion. Minimally invasive means faster recovery and lower risks of certain complications like bleeding or infection. There's also a lot less pain for people, and because the recovery is faster, a lot of people can leave the hospital the same day or the next day.
You mentioned fast recovery. Is there a timeline on how fast that recovery is? What do the days, the weeks look like afterward?
Sure. I'm glad you asked that. I'm going to pull out some props that I happen to have and show you. This is a coronary stent. If you have a blockage in one of your heart arteries, we can put a stent inside that heart artery and hold that blockage open. Usually people who have a stent can leave the hospital within about 2 hours.
Do you show them something like this before the procedure is done, maybe get them used to what is actually happening to their body?
Yes, very much so. In fact, I always keep this box with me. When I speak to people about the LAAO procedure, I usually show them the LAAO devices that are available, and there are 2 different devices available that can plug the left atrial appendage. And when I talk to people about the TAVR procedure, I showed them this valve model. This is actually a valve that can sit inside the heart, begins functioning immediately, is implanted inside a beating heart through a catheter, a tube, the size, as we said, of the hole in the tip of a ballpoint pen.
These, of course, are not something that everyone sees on a daily basis. What are their reactions to these type of items when you first show them? Are they scared, nervous, excited that you're actually showing them something that will be helping, working?
I think a lot of people find that seeing items, touching them themselves, really make things much more real. When I tell you I'm going to do a procedure inside your heart, you get scared, right?
Yeah.
Nobody's excited about that. But when I show you that I can take this device and I can crunch it down to this size, people are a lot more comfortable.
It helps, yeah. Can any of these be done as an outpatient procedure, or do they require a hospital stay? You said that something like this may be in and out of the hospital the same day. Are there outpatient procedures?
Yeah, so all the procedures in the catheterization laboratory are performed in the hospital, but often in a day stay or outpatient format. So the LAAO, or left atrial appendage procedure, for people with atrial fibrillation to replace blood thinners to prevent stroke, frequently same-day discharge. Coronary stenting procedures for people with coronary artery disease, with blockages in the heart arteries, frequently same-day discharge.
Are these both scheduled as emergency procedures?
We perform procedures both on a scheduled and emergency basis. And you can imagine that people come to the hospital on a scheduled and an emergency basis. There are people who, for example, come with shortness of breath or chest discomfort with exertion. And then there are people who come with crushing chest discomfort that wakes them from sleep. The latter sort of patient has a procedure performed in the middle of the night on an emergency basis. The former sort of patient has a scheduled elective procedure.
Is there one that you see more than the other, or it just depends on the day?
Yeah, so Bay State is fortunate to be a large regional referral center. We see a very large number of acute heart attacks. People come from all over the region. Each year we see more than 400 people who come with acute heart attacks. In addition, each year we do more than 300 valve replacements, and we're on track to plug more than 200 left atrial appendages this year.
You mentioned 400. Is that a lot?
It is. So in general, at Bay State, our catheterization laboratory performs about 7,500 or 8,000 procedures per year. There are more than 6,000 diagnostic procedures, taking pictures, determining what's going on in somebody's heart, and then approaching 2,000 interventional procedures, including stents, valves, and other procedures.
I'm sure you do a lot of procedures on adults. Do you see any children coming in with these complications and then therefore having to perform a procedure?
Sure. So I'm an adult cardiologist, and with that disclosure, I don't perform procedures on children. But definitely children do have heart conditions, particularly congenital heart disease is common in children. Children are frequently born with heart issues, malformations of the heart, holes in the heart, and those are things that can be intervened upon. They don't necessarily always require surgery. They can benefit from interventional cardiology, from minimally invasive catheter-based procedures.
All right, good information there. Heart disease is the #1 killer of women in the United States. After the break, we'll find out what's being done to target women's heart health. You're watching 22 News in Focus. We're back now with 22 News in Focus, where we've been learning about heart disease and the treatments available. In the last segment, we discussed procedures done in Bay State's cardiac cath lab. But in some cases, surgery is needed. Bay State Medical Center is home to the only cardiac surgery program in all of Western Massachusetts. Joining me now is Dr. Kelly Wanamaker, a cardiac surgeon at Bay State Health. Kelly, thank you for being on the program.
Thank you for having me.
All right, so let's get right into it, the basics. What is heart bypass surgery?
Heart bypass surgery is exactly that. It's meant to bypass a plaque that has formed in the arteries that feed the heart. So there are two main coronary arteries that feed the heart, and there's all these branches that come down to feed the heart muscle. And when there's a blockage, sometimes those blockages can be treated with stents, as Dr. Goldzweig had mentioned, but also if the anatomy is not favorable for that, if there's multiple blockages, we know there's a benefit, especially in diabetics, for bypass surgery. And what that involves is taking a vein from the leg or artery from the chest wall, sometimes an artery from the arm, and basically restoring the blood flow to the heart beyond the blockage. So I tell patients that we're kind of like plumbers, but we don't unclog the pipes, we build new pipes to restore the blood flow beyond the blockage.
It's a good analogy. Of course, technology has come such a long way over the last couple of years and of course decades as well. How has this type of surgery changed since the early days of open heart surgery?
Yeah, so cardiac surgery started about 100 years ago, and it's really come a long way. I'm really excited to be a heart surgeon now in 2024. Patients do much better. The machines have gotten better. The heart-lung machine is the machine that we use to stop the heart and lungs while we can stop have a quiet heart, a bloodless heart, to do a safe surgery. The machine has gotten better. The tubing, the way that the tubings have been treated, less complications. The conduit that we use, meaning what we use for bypass surgery, they used to sew directly to the muscle. We know that it's more effective to sew to the artery that feeds the heart. The way we protect the heart. So when the heart's stopped, it's really important to protect the muscle with a solution that has developed and changed over the years. It's more safe so that the heart comes back. Patients often ask me, is my heart going to restart once I've stopped it? And because of this myocardial protection solution that has been developed, has improved over time, it's safe. It's a safe surgery, and yes, it will restart. The anesthesia has changed, the way we treat patients after surgery and recovery. This is all progressive, faster. We get the patients off the ventilator quicker and up and out of bed moving. So big strides and a much safer surgery now.
And with all these advances, I'm sure that makes your job a lot easier too. And the patients feel, I'm sure, a lot better as well. What about heart valve surgery? What's involved with that?
Yeah, so there's 4 valves in the heart, and the most common valve problem that adults face is aortic valve stenosis, something that we spoke about earlier also with the transcatheter valve replacement on the segment. So aortic valve stenosis is a tightening of the valve that regulates the blood that comes from the left ventricle out to the rest of the body. This is important blood because it feeds everything in the body, the heart, the heart, the head, the lungs, the organs, and the rest of the organs, vital organs in the body. So this valve is really important. Over time, through aging and other reasons, it can become tight. So that's aortic valve stenosis. So if the patient's a surgical candidate, say they're young or they need other heart procedures at the same time, bypass surgery, for example, what we do is open up the aorta, the big pipe that comes off the heart, take out the valve, clean that up, and then sew in a new valve.
I want to talk about another procedure. It's called the maze, I believe. What is that and what is involved with it? So
maze was developed by James Cox. It is a procedure that is used to treat atrial fibrillation. That's a chaotic rhythm that comes from the top chambers of the heart, the atrium. And what it does essentially creates a maze of scar tissue that breaks up the foci, or the the cause for atrial fibrillation, and we use a combination of, originally it came out with cutting and sewing, but now in modern cardiac surgery we have things like cryoablation, which is a cold therapy to freeze and create scar, but also radiofrequency ablation, that is a heat that also creates scars. So there's a series of tissue scarring throughout the atrium that we create to break up that chaotic rhythm.
Speaking of rhythm, what causes irregular heartbeats and what corrective treatments are available for that?
Yeah, so irregular heartbeats can be from an electrical system just gone haywire, or other structural problems with the heart. Treatments can vary as simple as medications, but also there's cardioversion, which is shocking of the heart. Also, our cardiologist friends can use catheter-based ablation techniques similar to the maze, and then of course we have surgical ablation with the maze procedure that we offer in open heart surgery.
Cardiovascular disease is the top cause of death for women in the country of all ages. Doesn't matter how old you are. According to the CDC, more than 60 million women in the U.S. are living with some form of heart disease. What are the most common types of heart disease in women?
Yeah, the statistics are astonishing, and in fact now we know that heart disease is the #1 killer in women, and it tops all forms of cancer combined. So currently over 44% of women live with some form of heart disease in the United States. The most common, of course, is coronary artery disease, and after that, heart failure, arrhythmias. So it's quite high, and I think that one of the things that we are starting to discover are the hormonal changes with women as they age, and the lack of estrogen after menopause as a risk factor.
Earlier in the program, we spoke about heart attacks and the symptoms. Are there different symptoms for women who are experiencing a heart attack rather than men, or are all the symptoms the same?
Great question. This comes up a lot. It's twofold. One, women do have chest pain associated with a heart attack just like men do. The issue with that we're finding is less women tend to present because they claim that they have a higher threshold for pain than men. Therefore, they might write off their symptoms to say, you know, this is just me, it's stress, so they put it off. Two, there are different symptoms. Sometimes women will have abdominal bloating, nausea, vomiting, lightheadedness, shortness of breath, things that kind of we live with our whole life just because we're women. So those symptoms, they're not so quick to show up and say there's something wrong with my heart.
So at what point a woman is experiencing some of these symptoms, do they need to go to the hospital or see a doctor?
Yeah, I mean, if you know you have a family history of heart disease, if you have the risk factors, obesity, smoking, diabetes, high blood pressure, high cholesterol, it's never wrong to come and get evaluated. I think to be safe is better.
Is there a demographic at higher risk? We talk about men, women, different ethnic groups, but is there a specific group that sees this more than others?
Yeah, interesting. There was an article that came out last year in Circulation, one of our publications that we go to for a lot of our data that comes out, and the traditional risk factors are those ones that we've talked about. Diabetes, high blood pressure, high cholesterol, smoking, lack of exercise, too much alcohol intake. But for women, I think that we're just touching also on the fact that post-menopause and the estrogen, lack of estrogen being a risk factor.
And bottom line, I think, you know, if you do experience some of these symptoms, I would think you would recommend just go see a doctor. It never hurts.
Exactly. I agree. Never hurts. Always better be safe
than sorry.
Yes.
All right. The American Heart Association has been at the forefront of research and public awareness of heart disease for a century. We'll learn about what that organization does when we return. Stay with us on 22 News in Focus. You're watching 22 News in Focus. The American Heart Association is celebrating 100 years of service this year. What started out as an organization of health professionals looking to learn more about heart diseases has now grown to reach millions of people around the world. Joining me now to talk about the organization and its programs is Allison Perrin-Drag, the American Heart Association's Government Relations Director in Massachusetts. Thank you for being on the program today, Allison.
Thanks so much for having me.
All right, so let's start with some background on the American Heart Association. Of course, I'm sure a lot of people have heard those three words a lot, especially now this month in February. When and why was it founded, and what is the mission?
Sure. So, we were founded on June 10th, 1924, really because a group of physicians and social workers came together because, back then heart disease was really, once you got diagnosed with it, there was really nothing that people were doing, and you were basically on complete bed rest. And, these physicians didn't think it needed to be that way. So they took some time, they researched, they brought folks together, they met in Chicago, and they formed the American Heart Association, really believing that the scientific research could lead ways for better treatment, for prevention, and hopefully ultimately a cure. I think, early on they enlisted hundreds and then thousands of physicians and scientists, and that continues to grow today as the leading, voluntary health organization for all cardiovascular disease. Our mission is really to ensure that, we are preventing and treating cardiovascular disease, that everyone has access to equitable health.
What types of programs or services do you offer?
Yeah, so, we offer a lot. I think we're most well known for our CPR and AED training. We are the leading organization to create that recitation science, so making sure we're the guidelines, so really making sure that people are trained in that. Over 350,000 people in the United States suffer out of hospital cardiac arrest, and we know that just around 10 or 12% of people survive that. So we really are trying to get as many bystanders trained in CPR as possible, whether that's a full training course that healthcare providers can take or people that need that training, or if that is just the kind of hands only so that people know what to react when someone suffers a cardiac arrest in front of them. In addition, we do a lot of programming in schools. We have something called the Kids Heart Challenge. It's almost 50 years old, and we've been partnering with educators in elementary school, middle, and high school across the country to really help educate kids about healthy living, physical activity, proper nutrition. They help raise funds by really doing some fun activities, whether it's jumping rope or shooting baskets, and learning about the importance of heart health. And then I would say the last one to really highlight is around our support network. So if someone themselves is experiencing, cardiovascular disease, that they're not alone in that they have other people that they can be connected to across the country that may have a similar condition or maybe going through a similar surgery or experience, and they want to learn more and ask those questions. It also provides an opportunity for those caregivers to also be able to find the support they need.
You mentioned bringing awareness to children. Of course, it's never too early to start thinking about your heart health. How important is it to start at an early age discussing these very important topics, even if it's as simple as those activities?
Yeah, I think it's never too young. We do a lot of work even in that 0 to 5 range, right? Making sure that people know why it's so important to be physically active, get moving, get that kind of 30 minutes a day of activity, why it's so important to eat healthy and have those choices, making sure especially young kids aren't having sugary drinks. In addition, I think, we spend a lot of time making sure kids don't know the risks of, using tobacco products and nicotine, and that they don't start smoking earlier so that those risk factors can lead them to a healthier lifestyle down the road. The earlier I think you learn about this, the more likely that you're able to stick to those healthy habits and that you have a better shot at really having, ideal cardiovascular health.
You not only focus on heart health, but other information and offer other information about strokes as well. Is there a connection there?
Yeah, brain health and heart health is really connected. In addition, there's a lot of the same risk factors. So, for example, high blood pressure is a risk factor for both, as well as, if you have AFib, that puts you more at risk for strokes. If you smoke, we say that you should stop smoking, that your cholesterol numbers, that you control those. that if you have diabetes, that you're under controlling, you're watching what you eat, again, that you're exercising daily, that you're cutting down on those fats, the fats in your diet. They all have very similar risk factors. A lot of conditions are tied together. Sometimes people will have a stroke because of a hole in their heart, and that will, throw a clot. I think the biggest piece is to really think about what those warning signs are for stroke, very similar to what you heard earlier in the segment about the warning signs for heart disease. So, for a stroke, the simple piece is fast. So, if you're seeing kind of on your face that it's drooping to one side, that you're having some trouble there, it's usually on the mouth edge, and that you have arm weakness. So if you're trying to raise your arm and you can't raise it, that you feel like that, there might be some numbness down there. You have some speech difficulty. So maybe you're trying to say something and it's not coming out quite correctly. And then the T is really for time to call 911. For strokes, similar to heart attacks, time is really of the essence, right? If you're not getting enough oxygen to your brain, then there's going to be parts that could render you disabled in those pieces. So time in getting to that hospital quickly is really important.
The Heart Association is involved with patient advocacy and healthcare policy. What are some of the public policies that you are currently involved in?
Yeah, in Massachusetts and across the country, we have a really robust agenda. I would say, we've made some really amazing progress here in Massachusetts on our policy agenda. Things where we were first in the country on healthcare access. We were first in the country to eliminate the sale of all flavored tobacco products. We've made great strides on a number of those things. We had some of the strictest guidelines on school nutrition standards. So we continue to make sure those stay. We spend a lot of time on policies that would help improve outcomes from sudden cardiac arrest. So things like if you call 911, making sure the operator on the other end of the phone, that on the telecommunicator, is giving those hands-only CPR instructions. Creating a defibrillator registry so that we know where the closest defibrillator is in case of a cardiac arrest. Making sure our students know hands-only CPR in school. We're one of only a handful of states that don't require that as a graduation requirement. So trying to find ways to make sure that we are, creating this kind of next generation of lifesavers and a nation of lifesavers so that more people are able to react in a time of critical need. And that will help improve outcomes from sudden cardiac arrest. We also continue to make sure that we are not weakening any tobacco laws, that we're making it harder for youth to get hold of those products. We work around a lot of issues on maternal health and healthcare access, so ensuring that people are getting the care that they need. We work on ensuring that when you suffer a stroke, that you're getting to the right hospital as quick as possible, not necessarily the closest hospital. That's a kind of quick overview.
What types of volunteer positions are available for people who want to get involved and help?
Yeah, so there's a lot. We provide for a lot of events throughout the state, and so there's always volunteer opportunities to join, whether it's walking at a heart walk or attending, a Go Red for Women event. From an advocacy standpoint, we have a different opportunities. You can join our You're the Cure network, which is an online grassroots advocacy network where you can reach out to your legislators about issues that are important to you. You can always join us at the Capitol in Boston or out in the district if you want to meet with your legislators and talk about why heart health policies are important to you. We're always looking for people to share their stories. Unfortunately, I think there's so many people that have that personal connection to heart disease and stroke. And so we're always, really to put that kind of face to that story is so important, especially, in the policy world where people can really see how that's affecting someone, what that looks like. And so being able to share your story and all of that. So lots of opportunities. And
never too young, of course, to raise awareness as well.
No.
The American Heart Association sponsors the Go Red for Women campaign every February. When we come back, we'll find out how the organization is focusing on women's heart health. You're watching 22 News in Focus. Since 2004, the American Heart Association's Go Red for Women initiative had addressed the awareness and clinical care gaps of women's heart health treatment. It was just National Wear Red for Women Day last week. What is Go Red for Women?
Yeah, so this is our national program really to address you know, that the heart disease is the #1 killer for women. You know, most women actually don't know that. Only about probably just over 40% of women actually know that heart disease is their #1 killer. And that's certainly grown because of all the efforts of Go Red for Women over the last 20 years. You know, as said earlier, about 45% of women over the age of 20 do have some sort of cardiovascular event. And so we still have a lot of work to do. You know, women have a lot of inequities in terms of the differences of treatment that they get. Women are less likely to be given CPR during cardiac arrest, and about 23% of them are only men have 23% higher odds of survival from cardiac arrest than women. And you know, we certainly see research around women more underfunded. We don't see as many women in clinical trials, and so it becomes harder to, you know, make sure we're treating women the right way. A lot of times when women present with symptoms of heart attacks, they're turned away by healthcare providers. They're told that that must be stress or anxiety, even though they could be having a full-blown heart attack. Some of that is because sometimes the symptoms, you know, are a little bit different. They're not the classic heart attack symptoms, as, you know, I think the doctor previously reported on. You know, sometimes it can be nausea and jaw pain and really, you know, tiredness and fatigue. And so that can be easily explained away by, you must be tired, you must be stressed out. And women hear that all the time. And so they're not always getting treated. Women also tend to put themselves last. And so if they're not feeling right, they're not always going to the doctor. So, you know, our hope when we created Go Red was not only to bring awareness for women to know that heart disease is their #1 killer, more so than all cancers combined, but also to make sure healthcare providers knew that women might present differently, that they needed that care, that was important to them. We really are hoping that it helps women advocate for themselves and for their health, and to really kind of push that they get the care that they need and deserve.
And speaking of advocating, what are some ways people can get involved in the campaign?
Yeah, so if you go on heart.org or goredforwomen.org, there's lots of opportunity and to be involved, whether it's simply making sure that you're raising awareness, you know, telling families and friends. A lot of times you'll see the red dress pin, which is a symbol of Go Red, making sure that you hand that out. A big focus for us around Go Red Month is really learning CPR, is to make sure that more people are, you know, taking that. And so, you know, CPR is pretty simple, right? You call 911, you put your hands, you know, in the middle of the center of someone's chest, you push hard and fast for about 120 beats per minute. Anyone can do it, you know, and we can improve outcomes from that. In addition, we have events across the country around Go Red for Women. Here in Massachusetts, we do have an event coming up in Boston on Thursday, April 11th. That is really our Go Red evening celebration. There's more information as well on heart.org on that event as well.
We discussed earlier with Dr. Wanamaker about women's heart health. Let's talk about the AHA focuses on this event. Why are women more at risk for dying from a heart health event?
Yeah, I think some of it is just that, you know, like I mentioned before, a lot of times women are not going and knowing their numbers. They're not getting them checked. They don't know if they have high blood pressure or high cholesterol because, you know, they're just not fitting in the time to do that. Sleep is really important, and so making sure that women get better rest, that they take time for their mental health, slow down, you know, make sure they're getting themselves checked. Make sure they have time for physical activity or to eat healthier. That doesn't always happen. Is there, you know, a lot of, you know, women are running around, you know, doing everything for their families, and they sometimes forget that they need to take care of themselves, that they're not any good to their families if they're not healthy as well. And so, you know, for us, we just saw so many women not know their risk factors and not know that they were at risk for cardiovascular disease. And so Go Red for Women really wanted to ensure that we were improving that. We were improving outcomes, that women were more aware of that they really were able to understand why it was important to get the care as quickly as possible.
Studies have found that research and data collection for women's health has been underfunded and marginalizes the health risks and experiences of women of color and transgender people. Do you think this is why many women go undiagnosed for heart and stroke issues?
Yes, definitely, right? I mean, if we're not making sure women are part of clinical trials, if we're not making sure that we're testing different drugs or different, you know, surgery options on women, how do we know if they work, right? So if they're not part of that and we're not funding that and they're not represented in that space when we look at research, then it's impossible to make improvements on that. As part of the Go Red for Women movement, we are investing large amounts of funding into, ensuring that women are part of that. We're trying to make sure that women know about those opportunities for clinical trials, that they're part of those research. We have, Research Goes Red. We're really focused on those pieces for women, making sure that we have, doctors looking at that. Women's arteries tend to be smaller. So sometimes, the stents don't always work the same way as men. But we don't know that if women aren't in those clinical trials getting that help and looking at that, and then we can't really work to improve it. So that's a really big piece of the Go Red for Women movement, making sure we're doing that. We also see in terms of women, especially around maternal health, that cardiovascular disease is the biggest risk factor for postpartum death. And so making sure that women know, that they have the care that they need, that they have the access to that if they're hypertensive and preeclampsia during pregnancy, that they know that makes them at higher risk later in life to continue to have high blood pressure and be, more susceptible to cardiovascular disease.
You mentioned Research Goes Red, that initiative. How can women sign up for that program?
Yeah, so there's some information on goredforwomen.org or again on heart.org as well. So you can learn all about that and certainly look to participate.
And how many women do you see sign up for that program? Is there a great need for people to sign up?
I think there's always a need, right? There's always, we're always looking for, more involvement across the board on Go Red for Women. I'm not sure how many spots are available. I would just say, certainly if that's something of interest to folks, that they should inquire about more information.
And how can people contact the American Heart Association in Massachusetts? What do people need to know?
Yeah, so if you, go to heart.org, there is a lot of information there. That's our local number for our office that we are able to kind of direct you depending on the work you want. Like if you want to work on advocacy stuff, you'd come to me. If you're looking, to do community programs, you would go to our community impact team. If you're interested in one of our events, you'd go to our development team. And so there's lots of opportunities. I would say that as you look at heart.org, you can find different things of interest and then certainly reach out. There's a contact us button through that, and that goes to our national, but it gets filtered down depending on where you're located. So we're always able to get in touch really easily.
All right, great information there. We'll have some final words when we come back on 22 News in Focus. You've been watching 22 News in Focus. Today we've been discussing the issues surrounding heart disease, including prevention and treatment strategies as part of American Health Month. Thank you to all our guests for their expertise on this important health issue facing millions of Americans every day. And thank you all for watching at home. From all of us here at 22 News, have a great Sunday.